our 2:30 session of our 15-minute Knowledge is Power. Every time I say that, it makes me smile because I'm definitely a kid of the 80s. And so I remember the Saturday morning cartoons with the Knowledge is Power. I do believe that we have to lean into research and to theory and to what's being published right now in order to be really smart and hold some knowledge about what we're going to do next. So this is an attempt to give you some bite-sized pieces of that in order to think through what are some things and how can I proactively do intentional, healthy things as I continue to lead through pandemics and through a civil rights movement, both which are heavy to hold. I did begin this morning by being very clear with the audience members, the attendees, that this particular topic is very heavy for me. And I thought about actually leaning out from it. And one of the participants pushed me in a really nice way and said, no, this is actually why we should lean in. So this is an attempt to lean into the discomfort of the data that is current in our community. So I'm going to go ahead and start sharing my screen to talk about disproportionality in the age of COVID-19. Now, one of the things that we've been really paying attention to is just how different communities are experiencing the impact of COVID-19. And we're talking about the whole thing from getting diagnosed to being unemployed to losing your job to the level of healthcare that you're receiving. Very quickly, one of the very first headlines that we saw, oh, sorry, I forgot this. I really want to kind of center us in this belief system that we hold with this beautiful Martin Luther King Jr. quote about, sorry, that happens, about how we are really a network that's tied in a single garment of destiny. So whatever is affecting one directly affects us all indirectly. And so really, as we stand here as leaders at school systems and educators, we definitely hold the responsibility for all children, for all the members of the community that we serve. And so just kind of holding us into the collective. So pretty much right in the beginning of the pandemic, one of the very first headlines that was published was the first headline that you see up here, titled "The Black Plague." Now, immediately, the racialized way that the press was reporting on some of the news was something that caught our equity department's eye. And we started to hold a curated list by community. So we literally have a link of all of these publications that talks about the disproportional ways that this is hitting African American community, Hispanic community, Native American community, people with disabilities, and so on and so forth. If you're curious to see that list, and it is something that we keep updating, it is on the link here for the PowerPoint. I'm not going to click on it because I will tell you that at first it was something that we were wanting to make sure to be a part of and to be very current on. And after you get to about the 6th, 7th, 8th page, it gets to be really hard, especially when I'm represented in these headlines. So myself is represented, my nieces, my nephews, my son, and so it becomes very hard to receive this information. But as you can see, the headlines speak for themselves, right? So this is actually hitting certain populations in a very disproportionate way. So one of the words that we've been hearing a lot is how the pandemic has caused the exacerbation of equity gaps. Another word that actually the American Psychologists Association is using is magnification. And so I actually kind of lean in more onto that word just because it really kind of comes out to say, like, these are the inequalities that have always existed, and there's a magnifying glass to them right now, especially with the diagnosis, again, the economic shutdown, and the widening economic and health disparities that exist. Now, I know when I was principal, I went to visit the free health clinic where my kids would go, and I know that the level of care, bless their hearts, people are working really hard, but it wasn't the same level of care that I know I can take my own family to. So there's a lot of disparities that exist. And again, what are some of the resources that the community has that we're serving? Again, I mentioned, so this is going to have a lot of information like this. People with disabilities are also very much disproportionately represented in communities of color. So there's a lot of long-standing economic inequalities, and unemployment and underemployment is also hitting them very, very hard. So again, if you serve a large population that has people with disabilities, then the way that you're leading is going to be slightly different as well. This goes into the way that it's affecting our economic system. The superintendent from San Marcos and a couple of board members from Vista told us that they're actually seeing not a magnification of COVID cases, but a magnification of unemployment rates. And so the way that they have to support their families and communities are very different. I do want to say, if you haven't paid attention to the zip code information that is on our local San Diego County website, that will give you a very clear indication as to who is getting really battered by some of this information. Sorry, battered by the pandemic. And then, of course, we've gotten some really horrible news about the way our Indigenous youth and our Indigenous population is getting hit by COVID. I know that when I read the headline that Doctors Without Borders was being released internally in the United States, that is not an organization that does that. They go out to third world countries to help, but that is actually the dire straits situation that our Indigenous population is in as well. So again, the disproportionate ways that we're experiencing COVID is very different. So if we take this consideration with other considerations, when we see pictures of people out strolling at Balboa Park without a mask, and then we get these figures and numbers about how other people are experiencing this very differently, we have to pay attention to those inequities of experience. I really like the American Psychological Association website. I linked it here for you, so when you have the PowerPoint, you'll be able to see. But they have a lot of equity-related research and information. They're actually kind of keeping up to date with pandemic times, and then really thinking about brain research and then how this shows up in our behavior. It's been really fascinating. So they do have some great articles here. I took a snapshot to show you. So if you have time to go back and read at your leisure, then I highly recommend it, because this is actually a lot of the information that we're receiving, because we want to make sure not only are we talking about equity, but we're very certain as to what the research is saying about human developmental growth, trauma, and what we can do about our brain. So some of the themes in that long list of curated headlines is the rates. People of color have higher death rates, have higher risk of getting COVID-19, and that's actually a lot of factors. Actually that'll lead us down to another 15-minute session. The employment, the job losses, Newsweek reported that 65% of the Latinx population is facing unemployment due to this. So then that means that they lose their employer-provided health care. Small businesses are closing. The PPE loans that are being sent out to small businesses, a lot of people of color are actually reporting that they were denied. So even the help that was sent out federally, they're not qualifying for. Again, people of color tend to be our essential workers, our delivery drivers, our grocery store clerks. So there's children out there that are home alone while their parents are working, and so their experience of COVID is very different. And again, of course, the access to healthcare. I do want to hit on immigration status, because this is actually very real. There's families that have not wanted to take on the Chromebook to take home to do work, or go and get free lunch or free breakfast at the meals that schools are giving out, because they fear that this will impact their immigration status. So if they have applied to become citizens here, they cannot accept any help. Now, our lawyers have said this doesn't count. This isn't the type of help. The help that they're referring to is more like welfare and food stamps and that kind of thing. And so even though we say this, our immigrant population says, yes, and I don't trust the federal government to all of a sudden then turn around and say, you took this support. So there's a population, again, within the Latinx population, or within, I'm thinking about the students that I know I had that were from Laos or from Somalia, that if they're working on their immigration status, and that becomes something very important to take a look at. So I'm going to ask you, and I'm going to ask you to chat it. There are already disproportionality is a term that I want it to flow out of our mouth easily, because it already exists in public education. And I'm going to then push on us and say, sometimes we've grown numb. I mean, we can play this game where you tell me the name of a school and the geographic region in San Diego, and I can probably tell you their numbers. I can probably tell you who's getting suspended more, who has lowest achievement rates. We've kind of almost grown numb to taking a look at our dashboards. And so I'm going to ask you if you can put on the chat, what are some ways that this idea of disproportionality shows up in public education? So if you can please do that, I would I would appreciate it. I want to take a look at what you're writing. Yes, and then there's people moving back to Mexico. So what are some ways that you see? Overqualifying Black and Latinx students in special education? Yes, for sure, there's disproportional rates there. I know you know. Enrollment and advancement APIB courses, yes. When we take a look at numbers across, it's by demographic, it's very, very troubling. Rates of suspension, suspension rates, suspension and expulsion of African-American students beginning in preschool, yes. We definitely criminalize our African-American students very early on in the first institution they face, which is public education. So as you can see, we can name them. Instructional engagement, yes, that too. I started to kind of think about like, what are some of the ways that shows up, disproportionality shows up. And so I know that mine will look very similar. Oh, Eurocentric curriculum, yes. I have a story about that, but I only have 3 more minutes. Okay. So I kind of made a quick list. It matches many of the things that you said, but I wanted to engage you in this. So we have academic achievement rates, special education rates, of course, that was already named, but there's also learning disability rates, language acquisition, when you really start to tear apart how children are being assessed and then deemed children with special needs. Then there's also a disparity within the actual diagnosis. The behavior referrals, H through D graduation rates, access to AP coursework, which you said, and suspensions, expulsions. This list is really long. So if you ever want to get into the point with your organization where you want to tackle systemic, historical, oppressive structures, make this list and then start like knocking some of these things down, because that's actually what's going to get you to some real equity work, because we have some long-standing beliefs about how school runs that are just actually hurtful to many of the populations that we serve here, especially in San Diego and in California. Okay, so there's some implications here. So if we know that there's a disproportionate rate of COVID and it's impacting communities, if you're serving in a community where your school is mostly Latinx or it's mostly people of color, then the way that you're preparing intentionally re-engagement has to keep this in mind. They're probably going to be coming in with some sort of worry about essential workers or exposure or loss of a job or moving back to Mexico. I know someone put that in the chat box, but that's very real. There's a lot of children that are now quarantining in Tijuana because they had to move back. And so this is actually going to impact not only their academic growth, but their social emotional growth, their mental health, and positively their physical well-being. I am actually currently really concerned about the students that I would have served if I was still principal, because it was definitely a concrete jungle and full of apartment buildings. And so any outdoor space for them would be limited. And I know that impacts the way that we develop. We need nature and we need to be outdoors. So what are some things that we can do? I think we're poised to ask ourselves some of these questions. So how are you poised to help certain families upon reentry and re-engagement? How are you designing proactive supports for students as they return? And then how will you empathically understand and identify the level of COVID-19 related disruption students have experienced? If you have been joining us before, we did do a session on empathy interviews to truly understand and gauge the level of disruption for our families. I highly recommend, even if you can't go at it, I actually got an email from a principal saying, hey, I have 2,000 students. That just sounds like so big to conduct 2,000 empathy interviews. That's fine. Choose a group. I'll do empathy interviews with all my English learners. I'll do all my empathy interviews with my African-American families. We already know that certain populations are experiencing this disproportionately. Let's figure out who are our students along the edges and how we support them. And then, of course, what might we do? So again, my first bullet, and we're big believers in this, we really, as I want to say it's Ayanna Pressley. When she was running for office, she said the people closest to the pain should be closest to the power. So let's conduct those empathy interviews and really figure out what it is that we need to do to help support them as they re-engage, as we all re-engage back into society. And then what supports does your school have? Does your district have? Does your county have? Even at the city. I know on our resource page, if you go into our equity resource page, we have some supports from the San Diego District Attorney that are very helpful. Bring awareness to the site level or the district level. I know in my district, we had like from the school that I led to all the way up to La Jolla. So sometimes we have to be that head advocate and say, yes, and my school is experiencing this very differently. So the level of supports that I need at my school are going to look different than my colleagues. And so we have to have that level of advocacy. Understand, of course, the impact and experience of the community you serve. Be mindful of your own privilege and bias. We're all experiencing this COVID thing very differently. And identify a process and respond to accelerate individual student learning needs based on the variability of experiences. You get where I'm going. And lastly, provide culturally responsive social emotional support for students during this transition phase. I know I did not mention our current civil rights movement. That's a whole other layer that we also have to pay attention to of how students are experiencing this. I made it in 16 minutes with an interruption. I'm sorry. That was my son coming in. But so that concludes our short 15-minute Knowledge is Power session. We now just kind of hang out to answer any questions, any comments, and open it up to dialogue for whoever wants to join us. And we have our whole equity department here as well that can help. So thank you so much for your time. And I hope if you have any questions, please let's start discussing.